Our next speaker is Dr. Akil Palanisamy, who is a Harvard-trained physician and integrative medicine expert who combines conventional medicine with holistic approaches like functional medicine and Ayurveda. He completed his medical training at UCSF and Stanford with a fellowship in integrative medicine with Dr. Andrew Weil. Dr. Palanisamy practices at the Institute for Health and Healing in Sacramento, where he helps patients navigate chronic disease through personalized whole-person care. Welcome.
Mindfulness exercise, just to take a couple of minutes and arrive here before I dive into the rest of the presentations. So mindfulness can be defined as non-judgmental moment-to-moment awareness. We heard about it just in the panel talking about how this moment is all that we have, right? This instant, this second. So let's take that couple minutes to do some mindful breathing. So I'll walk you guys through it. So sit comfortably. If you can sit forward away from the chair with your feet on the ground, that's ideal. If you are not able to do that for any reason, just sit comfortably. And you can close your eyes if you would like, or just keep a soft gaze in front of you. And feel your feet on the ground. So the body can be a really great way to bring us into the moment. So just feel the sensations of your feet touching the floor. And then one of the best tools for bringing us into the present moment is our breath, which is always accessible to us. So what we're going to do is take some moments to feel where you notice your breath within your body. So just do a quick scan internally, just bring your awareness within and observe, where do you notice your breath? Perhaps you're noticing the movement of your abdomen in as you take a breath in and out as you exhale. Perhaps you're noticing the movement of air in and out of your nostrils as you're breathing in and out. And it's completely normal for the mind to wander. That's the nature of the mind. The mind's job is to think. So it doesn't mean you're doing it wrong. If you've started thinking about something else, just notice that and come back to observing your breath. So for a couple of more moments, we're just going to notice our in-breath and our out-breath, because the breath is something that connects us to our body as an anchor into the present moment and can help bring our awareness down out of the region of the mind and our brain, which can be very active sometimes, and into the present moment. And that actually is activating our parasympathetic nervous system, which helps with calming stress and helping with counteracting the sympathetic nervous system. So we'll take another 1 or 2 breaths together, just in silence. And then go ahead and gently open your eyes and come back to the room. And this was a very short experience of mindfulness, but hopefully gives you a taste of what is possible in terms of looking at coming into the present moment. So my talk today is about diet, inflammation, mindfulness, and PSC. So each of these could be a talk in their own right, but to discuss PSC, I want to use this framework that I call the TIGER protocol. And this is from my book of the same name about autoimmune diseases. So TIGER is an acronym that stands for these 5 drivers of inflammation. So PSC is an autoimmune disease, and there are more than 100 different autoimmune diseases, which all have the same commonality. It's a dysfunction of the immune system. So studies show there's 5 drivers of dysfunction in the immune system that apply to PSC and all autoimmune diseases. And these are the TIGER acronym: toxins, infections, the gut, eating, so we're going to talk a lot about food today, and rest, which includes getting good sleep and managing stress. So when we look specifically at PSC, this is how those drivers of inflammation come together. So on the upper left, the condition of dysbiosis is something we're going to talk about in the microbiome, which is all of the bacteria in your gut that regulate the immune system. And dysbiosis is a state of not enough good bacteria and too much harmful bacteria in a simplified sense, and also a reduction in diversity. So that's one of the things that's been seen in PSC. So there are certain bacteria that are known to be much higher in patients with PSC, such as Enterococcus, Streptococcus. For example, Veillonella, one study found that PSC patients have 5 times as much Veillonella as normal healthy controls. So every disease has its own dysbiosis signature, and the PSC signature is still being worked out, but it definitely has a dysbiosis component. Then with toxins, it's potentially from environmental pollutants or chemical exposures, but potentially dietary toxins as well. So for some patients, they're gluten sensitive. We recommend doing an elimination diet and reintroduction, figuring out what sort of toxins are responsible. And then infections and bacterial translocation are very important as well. There is something called pathogen-associated molecular patterns, or PAMPs, that's very significant in PSC, as we're going to go through some studies illustrating that. And that's where certain patterns from pathogens, bacterial pathogens, that release certain molecules enter through a gut barrier that's disrupted and enter the bloodstream and trigger inflammation, and also immune activation. And this is part of a condition called leaky gut, which is increased intestinal permeability. And we're going to see how that plays a key role in the development of PSC. So all of those factors are responsible for one of the main treatments of PSC, which is oral vancomycin. So this is one of the standard treatments for PSC, and the way it works, one of the mechanisms is by addressing dysbiosis. So it reduces bacteria that produce pro-inflammatory metabolites like secondary bile acids. So it's shifting the gut bacteria towards a more favorable profile. It's acting on those PAMPs, the pathogen-associated molecular patterns, such as LPS, which we're going to talk about later. So that reduces the immune hyperactivation and the cytokine-driven bile duct injury that we're seeing in PSC. And vancomycin is more than just an antibiotic. It's a modulator of the immune system. So it increases T regulatory cells, which are the peacekeepers of the immune system that help to keep the immune system functioning normally. And then it also boosts anti-inflammatory cytokines like TGF-beta that reduce fibrosis, and suppresses Th17-mediated, another immune cell-mediated inflammation, independent of antibacterial effects. So when we look at how one of the main treatments for PSC works, we're understanding that these gut bacteria, dysbiosis, microbiome factors are really key to the disease. So this was a paper that is called Circulating Markers of Gut Barrier Function are Associated with Disease Severity in PSC. And the circulating markers are within the blood, and markers of gut barrier dysfunction are things like LPS, which are something that are supposed to be within the gut, but if it gets into the bloodstream, that's inflammatory. And so this paper concluded that PSC patients show increased levels of circulating markers of bacterial translocation, where the bacteria are getting out of the intestine and into the bloodstream, and high levels within the blood are associated with poor prognosis as measured by transplantation-free survival. So we know that that's one of the key metrics in PSC, the length of time transplantation-free, and high levels of these markers of dysbiosis and leaky gut are significant. So the the authors conclude that ongoing gut leakage could have clinical impact in primary sclerosing cholangitis. So this is a bit more to explain what this concept is. So if you look at the image at the bottom, that's a schematic of a healthy gut lining in the intestine. So you have your intestinal cells, which are a one-cell thick layer within the gut, and there are gap junctions, which are the interconnections between them, which are supposed to be impermeable. But when you have this leaky gut syndrome, there's an increase in intestinal permeability, so the gap junctions are dysfunctional, and then things can enter into the bloodstream. So from the top there, which is the lumen of the intestine, you might have toxins, harmful bacteria, yeast, fungi, undigested food, things that are not supposed to be absorbed are entering the bloodstream and then driving the inflammation. This is another schematic of that to help understand looking at autoimmune diseases. So in this case, in the center of the figure are the intestinal cells, and on the right is the gut lumen, or the inside of the intestine. And then in blue is the mucus layer. So this is one of the ways the human body evolved to try to protect against leaky gut, keep that gut barrier very strong, is producing mucus within the GI tract. But when you have a thinning of the mucus, like as you see going up in the slide, the mucus layer is becoming thinner, then it's more prone to dysfunction, and the microorganisms are more easily able to penetrate. So in this, at the top, where you have a gap between the cells, where the tight junctions have broken down, then you can see this is the translocation, where bacteria can transfer into the circulation and then go to other tissues, cause inflammation. So in this paper, they concluded that the perturbation of the gut microbiota can lead to increased intestinal permeability and then translocation of bacterial components and products. And this translocation is what can trigger an abnormal immune response, causing inflammation or tissue damage in extraintestinal organs, such as the liver and bile ducts and so forth. So one of the PAMPs that's really significant is LPS. So this is what in that paper I mentioned was the one that was correlated with the severity of PSC and predicted the transplantation-free survival. So LPS is a compound found on the outside of certain bacteria, and it's not supposed to travel beyond the gut interior. It's only supposed to remain within the intestine. But if you have this increase in intestinal permeability, leaky gut, then that LPS passes into the systemic circulation, and the immune system reacts very violently to that because in severe cases, that can be a sign of sepsis, a life-threatening infection. And so even at a low level, the body immune system is really primed to trigger inflammation, treat it like an emergency, and respond very aggressively. So serum levels of LPS, lipopolysaccharide, correlate with the bacterial translocation and are used to gauge the severity of leaky gut. And in the paper I spoke of, this is what is associated with the more severe diseases in PSC. And the same thing actually holds true in other autoimmune liver diseases. So this is not PSC, this is actually AIH, autoimmune hepatitis, also another autoimmune liver disease. But I've just found this interesting that there's also a correlation with autoimmune hepatitis as you progress from healthy controls to those with AIH but normal liver function, and then with abnormal liver function and eventually cirrhosis, that you see a progressive rise in the LPS, indicating a progressive increase in the intestinal permeability. And the liver is the first target of altered gut permeability through the portal vein. So everything that is absorbed from your intestine passes through the portal vein into the liver for processing and clearance, detoxification. So the liver is really the first line of defense against what's going on within the intestine, and it's one of the reasons why the dysbiosis and the leaky gut have such a big impact in PSC. So let's talk a little bit more about the microbiome, which are the group of 40 trillion bacteria that we all have in our intestines from more than 1,000 species. So we have more microbes than human cells within the body, and 100 times more genetic material in the gut bacteria than in our human cells. And there's a lot of crucial functions that these bacteria play. They help with digestion, absorption. They regulate inflammation, not only in the gut, but in the whole body. They help protect against infections. They synthesize certain vitamins that are essential as well. And then with the immune system, about 70% of your immune system is in the gut, in the what's called the gut-associated lymph tissue. So the majority of those immune cells in the body are really concentrated around the gut. So one of the key markers for the health of the microbiome is the diversity. How many different species do you have? So this is one of the key metrics for health, because you want optimally the microbiome to be a very diverse ecosystem. You want, hundreds of different species, and this has been shown to be, when they looked at centenarians, those who lived to 100, they have unusually high microbiome diversity compared to others. And the main driver of diversity is the difference of the number of plants and polyphenols within the diet. So when you look at the number of different plants consumed in hunter-gatherer societies, when they've looked at archaeology and anthropology research, it was between 100 to 120 different plant foods per year, and sometimes more than 20 different species in a single day. And now the average American in a year eats about 10 different plant foods. And these are typically the same 10, plant foods that are consumed by a lot of people. Again, it's we're all creatures of habit, so we often end up just eating the same thing. And but this is a really significant finding because it directly impacts the diversity of the microbiome, which is one of the key ways that you can prevent these the dysbiosis and all the other consequences of that. So I'm going to talk today about my top 15 superfoods for the microbiome, and the factors that went into selecting these were fiber, like a diversity of fibers. These are mostly plant foods, soluble, insoluble, and resistant starch, which is another type of fiber. Also phytochemicals. These are plant chemicals, phytochemicals. These are extremely important as our primary defense against disease, and anti-inflammatory compounds. And then polyphenols are another prebiotic fiber, which is something that feeds your good bacteria. We also need omega-3s, which are essential fatty acids. They're essential not only for our human cells, but also for our bacteria. They do use omega-3s, and making sure you're getting high-quality protein and also nutrients like vitamin D and magnesium. So the first food is bone broth, which is something that is a fad now. It's extremely popular, but bone broth does have genuine gut healing properties through its glycine and gelatin and other amino acids. It is very healing for the gut. It doesn't seem to matter, chicken, fish, beef, any type of bone broth seems to work. For those who would prefer not to have bone broth, collagen powder is a reasonable substitute because that has a lot of the same compounds, a lot of the same gut healing properties. Then cruciferous vegetables are high on the list because all of the main crucifers, like your broccoli, cauliflower, Brussels sprouts, kale, they all have glucosinolates, which are these antioxidants that are really helpful for the liver to function well. And among these, broccoli sprouts are among the most nutritious and richest source of sulforaphane, which is a very powerful anti-inflammatory compound. So of course, all the crucifers like broccoli and cauliflower are great, but broccoli sprouts are the highest in some of the phytochemicals that are important, and you can grow them yourself, or you can find them in stores increasingly. That's another very, very healing food. And then leafy greens. So it could be any type of leafy green like spinach, bok choy, chard, and so forth. So we now know that these leafy greens have unique prebiotics called SQ sugar prebiotics. And these are not found in any other vegetable or any other food. So it's another reason why leafy greens are so good for us. Very anti-inflammatory, very rich in the phytochemicals. And you don't lose really that much when they're cooked, so it doesn't seem to matter cooked or raw with leafy greens. You're still getting a lot of the same gut healing benefits. And then let's talk about lettuce. Does anyone know what is the most popular type of lettuce that's consumed in the US today? Iceberg, yes, exactly. So it was great today at lunchtime. We had the romaine lettuce, which is wonderful. So romaine lettuce has 4 times as much phytochemicals as iceberg lettuce. So that was a great choice for lunch. And then these are some of the other more nutrient-dense forms of lettuce, like arugula, radicchio, and loose leaf lettuce. So arugula, when it gives you that peppery sort of aftertaste, that reflects the phytochemicals that are in arugula. And radicchio, you can tell from the intense color that it's very rich in the antioxidants and other anti-inflammatory compounds. And loose leaf lettuce that's pictured there is also an excellent option, far better than iceberg lettuce. So these are some options in terms of other green vegetables. So mushrooms are very powerful for the gut bacteria. So remember we talked about diversity is the key metric. And mushrooms are not plants, they are fungi, which is a different kingdom of life. So they have completely different components than plants, and that feeds a different set of bacteria. So the more different nutrients you have in your diet, the more different bacteria you'll have in the microbiome. And so mushrooms are a great tool to achieve that. And it doesn't seem to matter the type, whether it's your white button mushrooms or portobello mushrooms or oyster mushrooms, but it seems like the Asian mushrooms are especially powerful. Your shiitake, maitake, reishi mushroom, and a lot of mushrooms now are available in these mushroom powders. So you can find in the grocery store dried mushroom powders, which often give you like a blend of 5 or 6 different mushrooms. And mushrooms are very hardy, so they don't lose any of the health benefits when made into a powder. That's a great way to incorporate that, blend them in with tea or coffee or smoothie, but also eat mushrooms whenever you can. And that's a great tool to help with supporting the diversity of the microbiome. And beet greens, which are the leafy tops of the beetroot, are also exceptional. They're a rich source of trimethylglycine, which is a compound that supports methylation and healthy liver function. So methylation is one of the 6 ways that your liver detoxifies compounds. And another way is with glutathione, and beets have a compound called betalains that increase the activity of your glutathione enzymes, which is part of the phase 2 liver detox pathways. So I took this picture at my local supermarket, and we always try to get the beets with the greens still attached because they're more fresh. Usually if you find just the root, it's because the root lasts a lot longer and the greens have wilted. So definitely consume both the greens as well as the root when it comes to beets, and both are very supportive for the liver and for the gut bacteria. So berries of all types, very high in polyphenols, very anti-inflammatory. I think we've all heard a lot about berries, so I'll skip past that in interest of time. So the next 2 foods have high levels of resistant starch. So this is a key prebiotic that feeds your good bacteria. It's a different kind of fiber. And a good way to make rice of any type is you add 2 teaspoons of coconut oil to 1 cup of rice, just in your standard rice cooker. Cook, and then afterwards chill the cooked rice for 12 hours overnight. That increases the resistant starch content by 10x, and decreases the calories of the rice as well. So resistant starch is a starch that resists digestion, but your gut bacteria can digest it. They can feed on them. They will grow, and also then it makes the food lower glycemic because you're not absorbing all of the starch. It's like you're sharing some of it with your bacteria and some of it for you. Same with potatoes. So any type of potatoes, you cook them and then chill them for at least 12 hours. So like a potato salad or something along those lines would work. High levels of resistant starch are produced, and you can do this with either sweet potatoes, regular potatoes, and of course rice as well. Now, beans and legumes are one of the most beneficial foods for the gut bacteria because they have 3 different types of prebiotics that help your microbiome. They have polyphenols, they have galacto-oligosaccharides, and they can have resistant starch as well. So there was a study of 2 million people looking at which food category was the most associated with longevity, and it turned out to be legumes. So for every, I think, 20-gram increase in legume intake per day, there was an 8% increase in life expectancy. So beans, very, very simple. There's if you even canned beans are completely acceptable. Those are often pressure cooked in the cans, and just look for a can that is BPA free. But canned beans are just a perfectly acceptable way to get them. Now, your cold water fish like salmon, sardines, herring, and so forth are very high in omega-3s, those anti-inflammatory essential fatty acids. And those are essential for your gut bacteria, but as well as your human cells. So a lot of benefits to getting fish, and then it's a great source of vitamin D as well as vitamin A, which is important for the immune system. So probably the best fat is olive oil, especially if you can get the extra virgin olive oil. So very good for heart health and anti-inflammatory as well. With good olive oil, if you have a spoonful of it, when you want to have it, you'll also feel a peppery sort of flavor when you swallow, and that's how you know it's a good olive oil. You want to find one that is in dark glass bottles because olive oil oxidizes with light, and those are some of the ways to select a good extra virgin olive oil. Nuts of all type, nuts and seeds, extremely beneficial. It doesn't seem to matter. So peanuts are technically a legume, but legumes are also, healthy as we discussed. So nuts and seeds of various types, extremely beneficial. And then dark chocolate, this is always the easiest thing for me to sell, but it is true though, if you can have a good quality dark chocolate, like at least 70% or 80% cacao, the dark chocolate is very high in polyphenols. So it's the cacao in there, so you can also have cacao powder by itself. Excellent source of magnesium, very important mineral, and magnesium also helps with lowering blood pressure. But dark chocolate in small quantities, again, you only need like 2 to 4 ounces to feed the gut bacteria. You don't need a large quantity. And then either green or black tea, both are associated with reduced risk of heart disease, reduced inflammation, very high in polyphenols as well. And then herbs and spices of various types, underutilized, but excellent in terms of antioxidant content, as well as prebiotics for the gut bacteria and anti-inflammatory content. So I want to talk a little bit about fermented foods of all different types, like your yogurt, kombucha, kimchi, sauerkraut, and so forth, because there was a study at Stanford which found that taking in more fermented foods directly boosted the diversity of the gut bacteria in adults. And they went to the store and bought all these different fermented foods and measured the bacteria. And the good news is they had what the labels promised. So that's including the non-dairy and the dairy versions. And then in this study, they found that there were 19 different inflammatory cytokines that decreased in the 3 months that patients ate more fermented foods. This was one of the first studies to show that your diet has a direct effect on inflammation. There's other markers of inflammatory signaling that they studied, so the conclusion was pretty clear that fermented foods added to the diet, just your simple culinary quantities, it doesn't need to be a large serving, but consistency, having a little bit every day, seems to really help with inflammation. So here's a summary of the foods that I've talked about. These are supporting the diversity of the microbiome, providing the polyphenols, the different types of resistant starch, and other nutrients like magnesium, omega-3s, and so forth. So I don't have too much time to talk about fatigue, but I did want to highlight this paper, which found that fatigue in PSC is associated with sympathetic overactivity and increased cardiac output. So the PSC group in this study had increased sympathetic nervous system activity and reduced parasympathetic, and the fatigue was associated with autonomic dysfunction and activation of the sympathetic nervous system. So the body does have an antidote to that, which is your parasympathetic nervous system, which helps lower blood pressure, slow the heart rate, improves immune function, helps your gut function. And the good thing is that all mind-body techniques have the capacity to activate the parasympathetic nervous system, and mindfulness is one of them. So I like Dr. Amy Saltzman's definition that mindfulness can be defined as intentionally paying attention here and now with kindness and curiosity so that you can choose your behavior. Because between what's happening and your response, there's an instant where you have some choice, and mindfulness can help you to make that choice in alignment with your highest values. So mindfulness practice has been going on for millennia, and one of the main forms of mindfulness is meditation. So there's a lot of research about the neuroplasticity benefits of meditation. This refers to how your brain can change physically. The structure of your brain changes when you practice meditation. So MRI scans found that after 8 weeks of practicing mindfulness-based stress reduction, the hippocampus became larger, and this improved stress management, memory, learning, and mood. And then your brain has both gray matter and white matter, and meditation has been associated with increases of both gray matter and white matter. Also great for reducing anxiety, proven way to lower blood pressure, improve attention span, lower your stress hormones such as cortisol, and inflammation markers as well. There's a meta-analysis showing that meditation practices correlated with lower levels of C-reactive protein, which is one of the markers for inflammation. But if you're not a fan of meditation, any tool that to help manage stress will be effective, like whether it's counseling, biofeedback, meditation, deep breathing, just ordinary deep breathing like we're doing, or even hypnosis. So I'll wrap up here by just mentioning a way that you can work with me. So I'm not taking patients one-on-one, but I have started this new group visit series on the microbiome, which is a virtual group open to any patients in California, where we will do stool testing for the microbiome through any Sutter lab, standard lab, and I make recommendations for patients based on their test results. It's a 4-part series where we talk much more in depth about nutrition, the diet, stress, and lifestyle, all these factors. So yeah, you can call my Sacramento clinic with the number listed there to find out more, and I think we have flyers as well out front about this group visit, which is again through Zoom. It's a virtual shared medical appointment. And then finally, all this content was from my book, The Tiger Protocol, with a bunch more recipes, so please check that out for more info. So thank you so much for your time.